The gluteal region consists of superficial and deep muscles, nerves, and vessels that are essential for locomotion and stability. The largest and most superficial muscle here is the gluteus maximus. It originates from the ilium, the sacrum, and the coccyx. It inserts into the gluteal tuberosity and the iliotibial tract. It helps in hip extension and lateral rotation of the hip, especially during activities like climbing or standing from a seated position. It is innervated by the inferior gluteal nerve. The gluteus medius and minimus lie deep to the gluteus maximus. They originate from the ilium and insert onto the greater trochanter of the femur. These muscles are powerful hip abductors and medial rotators. They also stabilize the pelvis during walking. Both gluteus medius and minimus are supplied by the superior gluteal nerve. Beneath the gluteus minimus lies a group of short lateral rotators of the hip, which include the piriformis muscle, which originates from the anterior surface of the sacrum and exits the pelvis through the greater sciatic foramen to insert on the greater trochanter of the femur. It is a landmark muscle as the sciatic nerve passes below it. The gemellus superior, the obturator internus, and the gemellus inferior, they are muscles which forms a triceps-like group. The obturator internus exits through the lesser sciatic foramen with the gemellus superior lying above it and the gemellus inferior lying below. They all insert onto the medial surface of the greater trochanter of the femur and contribute to lateral rotation of the extended thigh and also helps in the stabilization of the femoral head in the hip joint. The quadratus femoris is a thick, square-shaped muscle that originates from the ischial tuberosity and inserts onto the intertrochanteric crest of the femur. It is a powerful lateral rotator and stabilizer of the hip joint. The gluteal region is richly supplied by branches of the sacral plexus. The superior gluteal nerve supplies the gluteus medius, the gluteus minimus, and the tensor fasciae latae. The inferior gluteal nerve innervates the gluteus maximus. The sciatic nerve, which runs deep to the piriformis, continues down into the posterior thigh.